my name is Haley McIntyre, and today I will be performing a catheterization on a female patient. Once I enter the patient's room, I'm going to check the provider's orders, and I'm going to gather my supplies, which is a cath kit. I'm then going to perform hand hygiene. I'm going to identify the patient by the medical ID number on their wristband, and then I'm going to also ask them to provide me with at least a last name or date of birth. I'm then going to ask the patient if they're allergic to iodine or latex. I'm going to provide the patient with privacy, perform hand hygiene. I'm going to go ahead and open my cath kit here. I'm going to go ahead and move this stuff over out of my way. I will then, I would put on clean gloves, and I would lift up the patient's blanket, and I would perform peri-care with the provided wipe, and then I would remove my gloves and perform hand hygiene with the Purell given. The next thing I'm going to do is I'm going to open up the cath kit. I'm going to begin by opening it away from me, touching the outer two edges only. Away from me, to the sides, and then towards me. I'm going to go ahead and churn this here. I'm going to take out my sterile gloves here. I'm going to move to the side, and I'm going to put those on. Touching the outer two edges only. 2 inches of the edges. And completely open that up. Making sure that it, of course, would not cross anything, so that way it wouldn't be contaminated. I'm going to step to the side as to not contaminate my left glove. By touching the cuff only, I'm going to pick up my right glove, and I'm going to step to the side, and I'm going to then insert my hand into this glove here. I'm going to then take my right hand and put it underneath the cuff here while stabilizing it with my other hand. Pick this up. I will then hitchhike my thumb out of the way. And get those on. The first thing I'm going to do is take the first drape out, which has a shiny side and a normal side. The shiny side will go down on the bed. That is the absorbent side. So I would take this, unfold it. I'm going to turn it so that the shiny side is away from me. I would then take my hands like this to shield my sterile gloves from getting contaminated, and make like a triangle here to properly shield, and see the shiny side will go down. So what I would do is ask the patient to lift up her buttocks, and I would put that right under her buttocks and make sure that's under her butt. I'm then going to take the fenestrated drape, which doesn't have a particular side, but I'm going to still unfold it, and I'm going to shield my gloves by making that triangle again. So as follows, to shield my gloves. This is going to go over the top of the patient. Ooh, unfold there. And I can only touch in the middle here. Kind of make that a little better. Okay, I'm then going to move my cath tray down to in between the patient's legs here. The first thing I'm going to do is open up the iodine and pour that across my cotton tip applicators. I'm then going to clean the labia. The first thing I'm going to do is put the sterile liquid on the balloon. I'm not going to pre-fill it. Just going to put that there. Make sure none of this touches anything outside of the packaging because it needs to remain sterile. I'm going to take this lubrication and squirt it in here. I'm then going to take this blue packaging off from the tip of my catheter here, just by walking it out, assuring that it doesn't get contaminated. I'm then going to dip that down into the lubrication. I'm going to take my non-dominant hand and spread the labias. I'm going to start with one cotton tip applicator, and I'm going to do the far side first, from top to bottom. I'm then going to pick up the second cotton tip applicator and do the nearest, from top to bottom. And then I'm going to take the last one and go down the middle from top to bottom. I'm then going to take the lubricated catheter about 2 inches to 4 inches from the top. Make sure that doesn't get unsterile. I'm going to slide in until I see urine. I'm going to assess the urine. I'm going to then advance 2 to 4 more inches more to make sure it's in the uterus. I'm going to remove my non-dominant hand from the labias and hold that into place so that way I'm able to fill the balloon. I'm going to go ahead and fill the balloon. I'm then going to tug just a little bit, make sure it's in place, and then I'm going to slide it back into position. I can then remove my non-dominant hand to help me get rid of that syringe. I'm then going to take out the catheter and put the stat lock on the patient's thigh. I would then use this clip and put this to the bed sheet, the top bed sheet, and then I would take this hook here and hang it on the bed frame itself. Once that is completed, I will remove all these things. I will then provide the patient with privacy again by putting the blanket back over her. I will clean up my mess, remove my sterile gloves, and I would document procedure performed and purpose of catheterization, amount and type of fluid used for the balloon, assessment of urine, patient tolerance of procedure, patient teaching and response. I would also initiate an INO record for this patient.